Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to Nourish MD, Doctor Dietitian Dialogues. My name is Romana. I'm one of your hosts today. I'm joined with Dr. Kathryn Cardoza. She is the newest addition over at PPMA. We're super excited to introduce her today via the podcast, discuss a really interesting topic, the topic of vitamin D, which I'm sure a lot of individuals are familiar with, especially coming out of COVID. Coming out of the winter season. As we know, vitamin D is very important for the immune system and also lots of other body systems. So we're going to get all into that today, but really wanted to take the opportunity to have a little chat with Dr. Cardoza, introduce her to our audience. Dr. Cardoza is board certified in internal medicine by the American Board of Internal Medicine, and she graduated from University of California at Los Angeles, UCLA. She received her medical degree from the David Geffen School of Medicine at UCLA, and she completed her internal medicine residency at Stanford. After her residency, Dr. Cardoza worked as a hospitalist as well as a primary care provider at Cedars-Sinai Medical Center. And within that capacity, she also served as an assistant professor at both UCLA and Cedars-Sinai, where she helped train resident physicians as well as medical students. Dr. Cardoza is an Orange County native, and she's super excited to return home to Orange County with PPMA for her practice and to give back to her local community. She also holds a medical staff position at Hoag Memorial Hospital Presbyterian. So Dr. Cardoza, thank you so much for joining us. Super excited to have you join us with PPMA. But what are you most looking forward to about joining PPMA now that you are well within practice and already serving our patients?
Yeah, well, thank you, Romana, first off, for having me here today. As far as what I'm most looking forward to about joining PPMA, I'm really grateful to be a part of PPMA because it allows me to provide personalized, holistic care with enhanced patient access, made possible by our excellent medical team and support staff. The relationships with my patients are what make my work really meaningful. And so the schedule flexibility, extended appointment times, allow me to really understand my patients' experiences and values and provide evidence-based medical care in a way that prioritizes these values. It's a privilege to be a part of my patients' lives as they grow and navigate new challenges, and to have the opportunity to really understand their needs and support them through the ups and downs.
Yeah. So thinking about preventative healthcare, which of course is such a pillar here at PPMA, being able to, like you mentioned, right, walking with the patient, alongside the patient through those ups and downs. What do you feel like is most important for your patients in regard to that preventative health aspect? And what are you most passionate about in terms of bringing to your patients on that front?
I believe it's important to be very proactive with preventative healthcare to prevent disease or catch and treat it early to minimize the effect on my patient's well-being. To me, preventative healthcare includes not only annual lab work and making sure patients are up to date on cancer screening, but also making sure we understand and address other important lifestyle factors such as diet, exercise, and stress management and mental health that have a big impact on health. I enjoy working together with my patients to create healthcare plans that really align with their lifestyle and goals to make a longer lasting impact on their health.
Yes. And I love that one of your focuses is really those annual health screenings, annual labs, things of that sort. And one of the things that we do monitor in a lot of our patients is vitamin D status, because we know, and as we'll talk about today, how vitamin D can influence various aspects of your health, right? So can you explain a little bit more about who might be at a higher risk of having low vitamin D levels?
Yeah, so the prevalence of vitamin D deficiency depends on the definition used, which we'll chat a little bit more about later. But the CDC National Health and Nutrition Exam Survey from 2011 to 2014 data on vitamin D levels found that most people in the U.S. aged 1 year and older had sufficient vitamin D intakes according to their thresholds. But 18% of people in the United States age 1 year or older were at risk of inadequacy, and 5% were at risk of deficiency. And these rates vary depending on race and ethnicity, with higher rates in non-Hispanic Black individuals. So that was 17.5%. And then non-Hispanic Asians are 7.6% compared to non-Hispanic white people, 2.1%. As far as Factors that increase the risk of vitamin D deficiency. The two main ways we get vitamin D are from eating food that contains vitamin D or supplements, and from production of vitamin D by our skin when it's exposed to ultraviolet rays. Vitamin D obtained from sunlight exposure and food is inactive, and it needs to undergo two reactions in the body for activation, which occur in the kidneys and the liver. So when I think about risk factors for vitamin D deficiency, they fall into several main buckets. Decreased intake or absorption of vitamin D, decreased skin production of vitamin D, decreased conversion of vitamin D into its active form, and increased breakdown of vitamin D. There are a few additional causes, but we'll focus on these today. So for the first bucket, decreased intake or absorption, there are certain diets that are associated with reduced dietary intake. Dairy-free diets for those who have milk allergies or lactose intolerance, ovo-vegetarian diets, which are vegetarian diets that exclude all animal-based foods except for eggs, or vegan diets. Other causes include conditions resulting in malabsorption, such as inflammatory bowel disease, celiac disease, gastric bypass surgery. Vitamin D is a fat-soluble vitamin, and absorption depends on the gut's ability to absorb dietary fat. Next bucket, decreased skin production, so limited sun exposure. There's an association with geographic location, so it's kind of related to that, but latitudes farther from the equator have higher rates of vitamin D deficiency. Older age is actually a risk factor for this. The skin's ability to synthesize vitamin D declines with age, and older people often have decreased sun exposure or dietary intake of vitamin D as well. Dark skin is a risk factor. The pigment melanin reduces the production of vitamin D from sunlight. And then for our other bucket, increased breakdown of vitamin D, certain medications affect vitamin D metabolism. And the main type of medication I think about for this is anti-seizure medications. Lastly, a decreased conversion of vitamin D to its active form. So you can see this with liver disease, kidney disease, certain hormone disorders. Higher body mass index or obesity may affect conversion of vitamin D to its active form, and greater amounts of body fat may also reduce available vitamin D.
Yeah, thank you for taking us through all of those. So again, thinking about why vitamin D levels might be decreased, going through those different buckets. Maybe it's decreased intake or absorption. And from a nutrition standpoint, right, we do want to focus on what are those food sources? And unlike a lot of other vitamins or minerals, vitamin D isn't as prevalent throughout the diet, right? So we do get it, like you had mentioned, if you haven't decreased intake of dairy products, a lot of dairy products are fortified with vitamin D. Egg yolks, good source of vitamin D. But other than mushrooms, which interestingly enough, if you leave mushrooms out in the sun, there's been some research to show that they kind of, just as we synthesize vitamin D from our skin from sun exposure, that mushrooms can do a similar thing. So you can increase the vitamin D content of mushrooms by leaving them out in the sun before you cook them, which is interesting. And most people aren't going to do that. But needless to say, definitely fewer food sources of vitamin D. So if you already have decreased absorption for vitamin D naturally, on top of decreased intake, that's definitely going to be a large aspect that can lower your vitamin D levels. There's also particular genetic dispositions that will affect how you're absorbing vitamin D. So not necessarily saying everyone has to go out and get that level of genetic testing done to determine what your efficiency is of absorbing vitamin D or of converting that vitamin D from a genetic standpoint, but just something else to consider. So that's a very large bucket that we want to consider, in addition to decreased skin production, as well as that increased breakdown of vitamin D and decreased conversion of that vitamin D into its active form, or that decreased activation, again, in largely the liver and in the kidneys as well. So thanks for taking us through all of that. Now let's talk about the role of vitamin D in the body. And how is vitamin D more than just a vitamin? Let's talk through some ways that it impacts bone health, muscle health, and other body systems.
Yeah, so vitamin D is important for bone health. It promotes gut calcium absorption, maintains adequate blood calcium levels to allow for normal bone mineralization. It's essential for bone growth and remodeling, and it helps protect against osteoporosis. Vitamin D is also involved in the normal development and growth of muscle fibers, which helps support the bones. Deficiencies in vitamin D can lead to muscle weakness and pain, slower bone growth, slower weak bone structure, and increased risk of skeletal deformities, osteoporosis, and fractures. Vitamin D also has other roles in the body, and it's involved in cell growth, immune function, sugar metabolism, and pathways related to inflammation. There have been links between vitamin D deficiency and major diseases such as cancer, infections, like COVID, autoimmune conditions, neuropsychiatric conditions, and cardiovascular disease. However, a lot of the data that's been collected has been via epidemiologic or observational studies, which don't demonstrate a causal relationship of vitamin D deficiencies and these diseases. The data from randomized controlled trials has been insufficient to confirm a causal relationship and it has been contradictory. There's also conflicting data regarding vitamin D and the effect on the development of diabetes and mortality. The Endocrine Society conducted systematic reviews of clinical trials evaluating the effects of vitamin D on the risk of these conditions and found a beneficial effect of vitamin D on the risk in certain populations. This actually prompted the society to update its guidelines in 2024 to suggest vitamin D supplementation in addition to lifestyle modification for adults with high-risk prediabetes to reduce the risk of progression to full-blown diabetes. The guideline also suggested empiric or preventative vitamin D supplementation in adults 75 years or older because of the potential to lower the risk of mortality. In addition to these conditions, the Endocrine Society's systematic review of vitamin D and pregnancy outcomes resulted in the society's suggestion for empiric vitamin D supplementation during pregnancy, given the potential to lower the risk of preeclampsia, intrauterine mortality, preterm birth, small for gestational age birth, and neonatal mortality.
So interesting. So obviously, as we can see, a wide variety of ways that vitamin D impacts the body. And I think it's important to, as you've pointed out, some conflicting data and just the fact that the research isn't necessarily pointing to cause and effect, right? But more so we have these larger studies. It's really important for this to be individualized, right? And based off of your labs, should that be indicated, and your individual health situation. So that's a great opportunity for your care provider, and whether you're working with a dietitian as well, to collaborate and kind of see the best route moving forward in terms of what makes the most sense for you and your individual health conditions and health considerations, right? So that being said, let's chat a little bit about vitamin D screening and how are we testing for whether that's suboptimal vitamin D levels, optimal vitamin D levels, and what that even means. So let's start with, where do you like to see vitamin D levels on a blood test, Dr. Cardoza?
Yeah, so the optimal serum 25 hydroxy vitamin D concentration, which is the test that we use to measure the levels in the blood for skeletal health, is controversial. Experts agree that levels lower than 20 nanograms per milliliter are suboptimal for skeletal health. The optimal serum level or blood level for extraskeletal health, so outside of the bones, has not been well established. The National Academy of Medicine supports vitamin D concentrations above the 20 nanograms per milliliter, or this is 50 nanomoles per liter, based on evidence related to bone health. There are other experts like the National Osteoporosis Foundation, the International Osteoporosis Foundation, and the American Geriatric Society that suggest that concentrations of at least 30 nanograms per milliliter are necessary in older adults to minimize the risk of falls and fracture. I'll say the safe upper limit of vitamin D level is also controversial. There have been some concerns that blood concentrations of vitamin D above 15 nanograms per milliliter could cause issues. And there was some data suggesting increased fracture in patients treated with high-dose vitamin D. And I'll say that the at-risk for vitamin D toxicity, overt toxicity, is typically over 100 nanograms per milliliter in adults, and particularly those ingesting substantial amounts of calcium.
Yeah, so you can see, of course, going from that 20 nanograms per milliliter to 100 nanograms per milliliter, that gives us a lot of room for nuance and for taking into account your unique health situation, your symptoms, other possible disease states, other nutrition considerations as well. So let's think about who we want to screen. Are we just testing everyone for vitamin D? Can you give us some more insight in terms of who especially we might want to be screening for any suboptimal levels of vitamin D?
Of course. In thinking about who might benefit from screening, I like to refer to the framework we discussed earlier for people who are at increased risk. So there are some medical conditions to also consider, but we discussed some of the main risk factors, which were decreased intake or absorption of vitamin D, decreased skin production of vitamin D, decreased conversion of vitamin D into its active form, and increased breakdown of vitamin D. In addition to this, there are certain conditions such as osteoporosis or low calcium or calcium disorders, for which it's important to ensure adequate vitamin D levels. So these patients are also screened. Most medical organizations do not recommend screening for vitamin D deficiency in individuals who do not have risk factors, given there's insufficient data to balance the benefits and the harms of screening. There are variations in recommendations for screening for vitamin D deficiency in patients who do have increased risks. Ultimately, it's important to have a discussion between you and your provider about whether you might benefit from screening.
Yeah. And as a whole, I would say in practice, we do see benefits from screening just as a whole within our patient population, specifically being in that we are seeing more of that geriatric population and more individuals who have that lower level of vitamin D given their health conditions, right? So again, always wanting to take into account what those conditions are. We just so happen to see a population that does have more of those increased risk factors. So that being said, once we do screen, once we do see vitamin D levels, that will help determine whether or not supplementation would be warranted for an individual. Let's talk briefly on vitamin D supplementation, which is very common, I would say, in society at the moment.
Yeah, so I think maybe it'd be good to start with, reviewing the sources for vitamin D include diet, supplements, and then sun exposure. And the optimal intake to prevent deficiency recommended by the Institute of Medicine, and it's now called the National Academy of Medicine, for vitamin D in healthy individuals aged 1 to 70 years old is 600 international units daily, with a recommended dietary allowance of 800 international units daily after age 70 years old. Some societies recommend slightly higher intake in adults 65 and older. For example, the American Geriatric Society recommends a vitamin D intake of 1,000 international units daily, and the National Osteoporosis Foundation recommends 800 to 1,000 international units daily. Certain high-risk groups may have lower vitamin D levels at this intake level and might require higher intake, in which case we would consider supplementation. And really, it's determining when these individuals are unable to maintain appropriate levels of vitamin D at the recommended intake, we would start the supplements. As we previously discussed, the Endocrine Society 2024 guidelines also recommend empiric or preventative supplementation in specific populations. So individuals with prediabetes, pregnant individuals, and those aged 75 years or older. In addition, the society recommends empiric supplementation in children aged 1 to 18 years old.
I think that's really helpful to review what that optimal intake is, and then individuals can assess based off of their intake, again, what they're getting from dietary sources. I know it's harder to kind of get a reference of what you might be actually getting from sun exposure. We are located in Southern California, so definitely closer to the equator than other parts of the United States. That being said, let's chat a little bit about sunscreen use, because I know we often emphasize the importance of sunscreen in terms of supporting skin health and preventing skin cancer. Of course, that is then going to inhibit how much sun you are getting. So why don't we talk about the nuance there? Does using sunscreen affect if and when we want to supplement, and how does sunscreen use affect how much vitamin D we are able to synthesize from sunlight exposure?
So high SPF broad spectrum sunscreens are designed to filter out a large majority of UV radiation, including type B UV radiation, or UVB, which is a major cause of sunburn and can lead to skin cancer. UVB happens to include the wavelengths that trigger vitamin D production in the skin. In experimental settings, there's evidence that vitamin D production is reduced by the application of adequate amounts of sunscreen before UVB exposure. However, there's no evidence from randomized controlled trials or long-term studies in real-life scenarios that sunscreen use significantly suppresses vitamin D production. This may be because no matter how much sunscreen is applied or how high the SPF is, some of the sun's UV rays will reach the skin. Most people don't apply the sunscreen perfectly, such as using the appropriate amount or thickness and reapplying at the appropriate frequency. Since UV exposure is the most preventable cause of skin cancer, and type A UV radiation exposure also is associated with premature skin aging, I recommend regular application of at least SPF 30 broad spectrum UVA, UVB sunscreen and use of sun protective clothing. And then adequate vitamin D can be obtained through diet and, if need be, supplementation while you take these measures to reduce the risk of skin damage and cancer using appropriate protection.
Yeah, thanks for walking us through that. And we have some great interviews as well with skin health experts who would agree and who would say the same. So let's chat about the different forms of vitamin D. Some individuals, if they have supplemented or if they've seen vitamin D supplementation on the shelf, you may have noticed that you have vitamin D3 as well as vitamin D2. So can you talk us through the differences between those two forms of vitamin D?
Yep. So in foods and dietary supplements, vitamin D has two main forms, D2, which is ergocalciferol, and D3, which is cholecalciferol. And these two forms differ slightly in their chemical structure. Both vitamins D2 and D3 raise 25-hydroxy vitamin D levels. In addition, most steps in the metabolism and actions of vitamins D2 and D3 are identical. However, there's evidence that vitamin D3 increases the blood levels to a greater extent and maintains these higher levels longer than vitamin D2, even though they're both well absorbed in the gut. So some experts recommend using D3 over D2 if available.
And are there any risks of taking too much vitamin D? I'm going to answer my own question and say that, yes, we know that there are risks, given that it is a fat-soluble vitamin and it can reach that toxicity level, which I know that you had mentioned. Particular organizations say that 100 nanograms per milliliter is really like that upper threshold, that kind of toxicity level that we might consider.
At PPMA, we are happy to offer a virtual one-on-one nutrition counseling to new and existing patients. Meet with me, Romana, one of your PPMA registered dietitians, to create a nutrition and wellness plan that is tailored to your goals and specific health conditions. Call the office today to schedule an appointment.
Let's chat through the risks of taking too much vitamin D.
With some organizations advising an intake of 800 to 1,000 international units daily after age 65. If individuals are found to have low vitamin D, they should take additional supplementation. You should wear your sunscreen, talk with your provider about whether you'd benefit from vitamin D screening or supplementation, and be aware that taking too much vitamin D can result in adverse health effects.
Thank you so much, Dr. Cardoza, for all of that amazing information. So if you are a PPMA patient and would love to get working with Dr. Cardoza, please just give the office a call. Let us know. We would be more than happy to set you up for that initial consultation. If you're not a current PPMA patient and would love to get to know our office or Dr. Cardoza, one of our other amazing doctors, you can check out our website at privatemds.com. We will have that information in the show notes as well. Give us a call, schedule a referral. We would love to meet you and to get you set up. So thank you so much, Dr. Cardoza, for your time today, and really looking forward to all of the wonderful work that you are about to be doing at PPMA. So we're so happy to have you.
Thanks, Romana.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.